All couples have a 3 to 4% chance of having a baby with a birth defect. Down syndrome is the most common birth defect in the United States. It can be caused by 3 different types of abnormal cell division involving chromosome 21.
Characteristics of the disease include low muscle tone, flat facial features with a small nose, hyperflexibility, and an enlarged tongue that tends to stick out.
Trisomy 21 is the most common occurrence. It is a non-disjunction when an extra chromosome develops in either the sperm or the egg. The rarest kind of Down syndrome is mosaic trisomy 21. The difference here is that the extra chromosome is present in some, but not all, of the newly developed cells. Translocation trisomy 21 occurs when part of the chromosome 21 becomes attached to another chromosome before or at the point of conception.
1 out of every 691 babies in the United States are born with Down syndrome every year. That is about 6,000 babies born a year with Down syndrome. Today, about 400,000 Americans are affected by this disease. Trisomy 21 accounts for more than 90% of the cases of Down syndrome seen in the United States.
New technology that is used to detect genetic disorders in the womb includes screening tests and diagnostic tests. Screening tests help identify the possibility of Down syndrome and are therefore non-conclusive. The goal is to estimate the risk of having a child with the disease. A positive result from the screening test leads to doctor recommendation for a second diagnostic test. The 3 types of screening tests are first trimester, quad marker, and triple screening. The diagnostic tests include amniocentesis, chorionic villus sampling, and percutaneous umbilical sampling. These will provide more conclusive results.
An estimated 92% of all women who receive a prenatal diagnosis of Down syndrome choose to terminate their pregnancies. As a woman ages, her chances of carrying a child with Down syndrome increases drastically. A 30-year-old woman has a 1 in 800 risk, while a 45-year-old woman has a 1 in 50 risk or greater.
The reasons to test or not test on an unborn child vary from person to person, as do the reasons to terminate or carry the pregnancy to term. Performing the tests will help expectant parents plan for possible lifestyle changes, special care the child may need, and make the decision to carry the child to full term or not. Some parents or couples may decide to not perform the test for a variety of reasons, including personal, moral, or religious beliefs. As with any medical procedure, there are risks that may harm both mother and child.
If a couple does decide to go ahead with the testing, reasons for terminating the pregnancy become personal. The series of tests happen once for 1 day of your life. Choosing how to go forward and dealing with this information is something that will affect every single day of the rest of your life. The ethics debate is one that has been and will continue to be argued, especially when human life is on the line. Now that you know more about it, what would you do? Would you abort or continue the pregnancy?